The Chief Consultant Radiologist, National Hospital Abuja, Dr. Olubunmi Olatunji says mothers who do not breastfeed their babies at all are 5 times more at risk of contracting breast cancer than others. Olatunji disclosed this during an interview with the news agency of Nigeria, NAN, on the sidelines of the Work and Talk organized by the Departments of Radiology, Radiotherapy and Oncology of the hospital to commemorate the Breast Cancer Awareness Month.
Other risk factors like women that are obese, women who take alcohol, smoke, and live sedentary lifestyle. You don't move around, you just sit down there anyhow. You don't do exercise, you don't burn off the fat. Then those who are never had children is also that what we call nulliparity. So it also increases your risk. We are not saying causes because there is no cause for cancer in any part of the body. It's just risk factors, things that we found that are common in people who have been diagnosed of cancer. So that's what I'm talking about. Then women who have children at a very elderly age, who we call the elderly primigravida. That is your first term pregnancy at 35 years and above. Also increases your risk of developing breast cancer. Again, women who breastfeed, but they don't do exclusive breastfeeding. You are breastfeeding, but you don't do it exclusively.
Olatunji said that the present statistics indicated that 1 in every 8 women had the disease, as against 1 in every 9 women in 2004, indicating that it was getting worse.
Diagnosis of breast cancer is not a death. It's not a death sentence. There are a lot of treatments available. You have what they call chemotherapy. You have radiotherapy. You also have surgery. The breast can be removed. The lump can be removed and all that. So it's not a death sentence. And that's why we always prefer for it to be detected very early, at this pre-malignant stage, before it becomes malignant, which we call the ductal carcinoma in situ, DCIS. If you are treated at that stage, you can even live cancer-free.
So Uchechukwu Chagaya, head radiotherapy and oncology department, said that breast cancer sometimes do not even come with any visible symptoms or signs, which was why screening once in a year was very important.
Cancer sometimes can come with no sign. So all the more reason why I want people to go get screened. Once you have, go check your breast every month, immediately after your cycle, and then go and get screened, so that it can even be caught before it becomes a full cancer. When it has fully become a cancer, it could be a breast lump, it could be a change in skin texture, it could be a rash or redness, it could be a swelling, it could be breast discharge, it could be a swelling in the armpit or around the collarbone. For the men, get your wife screened, get your mother screened, get your sister screened. Check your wife's breasts.
Cancer is of stages. Yes. When you don't nip it at the first time, when we have stage 1, stage 2, stage 3, stage 4. It will get to a stage at which when this patient comes to the clinic, all the doctors will need do is to just handle you palliatively, just to manage you for a peaceful death. That is, you have over-delayed. And we used to see this in the clinic a lot. Many patients will come after the doctors have finished diagnosing and giving them prescription. We will not see them again. So,
a global effort to raise awareness on breast cancer, October was designated as the Pink Month to increase awareness and the support for detection and treatment.